Friends, just indicate in the chat box. My audio visual is absolutely clear. Okay, so let us start. Let us start. Friends, the questions I have got, sorry, I got a little busy today, but seeing your enthusiasm, I'm here. This was the first question. Do keep on indicating in the chat box that this was session 1 or 2. I think this was session 1, if I'm not wrong. Calculate the median from the given set of observations. Students were fighting. There were 7 values or 8 values. Majority of students mentioned these were the values, right? So median was easy to calculate. You have to just confirm the answer. Arrange in ascending order. I've arranged in ascending order. I think one value they gave out of the profile, right? So look at these two. These are your two middle values. Take its average. So 4.5 becomes the median, one of the easiest questions of the paper, right? Okay, let's move forward. Okay, sorry, the question and image is overlapping. They showed an image showing different type of food items. Food items, right? Okay, in case this was not given, then 4 and 5. If this was not given, 4 plus 5 by 2. Because students are mentioning differently. Some were saying 4 was given, 4.5 was given, 4 and 5 were given separately. Don't worry. I am telling you the various possible options. Whatever you have seen and whatever your marked is going to be correct depending on that, right? In case values are not similar, doesn't matter. Look at the middle value. If you get two middle values, take its average. That was the best thing, right? Majority of students were of the view 4.5 was given in the question. Therefore, I was in the chat box also, it has been confirmed by the majority of the students. Okay, image were different food items and they were asking you to identify the source of thiamine. If they had marked A, B, C, D. Okay, Dr. Bhumika says 6.5 was coming by dividing. Dr. Bhumika, if average of two middle value was coming 6.5, then that would be correct. That would be correct, but depending on the question, because always we get different versions of the questions. Okay, yes, pen was not there to arrange, but this is how we have to do. Okay, if they're asking you to identify thiamine, then you have to go for rice. Rice is the best source of vitamin B1. And only problem occurs, as we have discussed in our mission lectures, main videos, and marathon sessions also. Outer layer of rice, when it is removed, then it starts shining. And then thiamine deficiency occurs, that is polished rice. So please remember, rice eating is not a problem. Polished rice eating is a problem we have discussed. So rice is the one of the good sources of thiamine in diet. Thiamine in diet, right? Okay. I think there was a question on full form of JSSK. We have discussed so many times in classes that full form sequence based questions we have to discuss. Janini Shishu Suraksha Karikram is the correct answer. What I want to know from you is what were the other choices? I'm sure one must be Janini Shishu Swasthya Karikram, or there must be something related to Janini Shishu Suraksha Karikram. Please help me complete the choices, or you can WhatsApp to this number. Let us go faster because many other faculty are waiting. So this was right. Okay. So Janani Shishu Suraksha Karikram. In demographic cycle, they asked, what does this curve blue arrow marked represents? So I'm sure we have discussed it multiple times across all these sessions. Pink line is your birth rate. Blue line is your death rate. Red line is your total population. You can see it is declining in phase 5. Phase 5, right? This is done. Okay, let's move further then. So according to what you have told me, it was the death rate they asked to be marked in this particular diagram of demographic cycle. Then they asked about this instrument. Instead of 4, I got 5 choices from the students. All of us have discussed this multiple times. Earlier, it was used for cooling power of air. Nowadays, it is used to measure low air velocity. Low air velocity is the answer because the instrument we are looking at, Carter thermometer. I discussed in all my mission sessions also, only 2 thermometers are asked in the exam. One is dial thermometer, one is Carter thermometer. And I told you the identification feature, red bulb at the end. Red bulb at the end is Carter thermometer in case it was there, right? Okay. Then let us move further, friends. Now, in this particular questions, students, half of the students are saying HDI was asked, half are saying P QLI was asked. So you have to tell me, were they in? That's what, okay, doctor, kuch bhi chal raha, I know this question will come later. Were they in different papers? In one, they asked if low air velocity was not in the option, then older answer is cooling power of air. Then older answer is cooling power of air. If low air velocity was not in the question, if low air velocity was not in the question, then you will go for the older answer, which is not used now. That is cooling power of air, right? Okay. Now, HDI, PQLI, both were asked in the paper. I presume they were asked in different sets because students both were convinced that HDI was asked, PQLI was asked. HDI was in paper 1, PQLI in paper 2. So let's quickly go through life expectancy at birth here, life expectancy at 1 year here. Here we have income per capita, which may be measured in GDP or purchasing power parity. Here it is IMR. In both, we have literacy rate, which is measured usually in terms of mean years of schooling if they gave in the choice, right? So I'm presuming 100% of you, 100% of you have attempted this question correctly, right? Okay. Let's move further. Then there are submerged portion of iceberg shows which disease. I think we have discussed in our many sessions that iceberg phenomena is not shown by mainly 5 diseases. These are measles, rubella, tetanus, rabies, pertussis. So if they are showing a diagram like this, it has to be influenza which shows iceberg phenomena. Iceberg phenomena. Yes, Dr. Kavita, if low air velocity was not given in that question, please go for cooling power of air. See, actually your YouTube has a lag of few seconds. Therefore, we are having this discrepancy while discussing. Right, Dr. Kanav, you are also right, right? Okay. Even if chickenpox was in the option, chickenpox is very evident, friends. Chickenpox is very evident. What will happen? A case of chickenpox will definitely come with lesions, which you can definitely see pleomorphic, dew drop on rose petal appearance. Yes, right? And centrifugal distribution. So chickenpox iceberg phenomena would be like this. But students categorically mentioned that there was a small tip. And that has to be a disease like influenza, which has multiple presentations, right? Okay, let's go further. Then we were asked a question on maternal deaths per 1 lakh women in reproductive age group. Friends, we have discussed many times in our classes. Ratio is maternal death upon live birth into 1 lakh. This is mainly used for comparisons on this planet. Even RCH program uses that. But in case they ask you maternal mortality rate, this is by per 1 lakh women in reproductive age group. Then also influenza. Then also influenza. Okay, image was same iceberg phenomena, then also influenza. Okay, 1 lakh was not given. Then also maternal deaths per live births expressed per live birth is maternal mortality ratio. This is more commonly used in the world. Less commonly used is rate, which was per women who are in reproductive age. So this question, if they have asked for reproductive age group, which many students have confirmed, answer is going to be maternal mortality rate. Maternal mortality rate, right? Okay. Was there any question on growth curve? Because students told me, but I was not able to find any choices. Friends, was any question given to... Yes, I'll come to those questions which you are saying in paper 2. I'll come to those questions also. Any question from growth curve? I don't know which growth curve. Was it growth chart or something? Okay, so let's move forward. There was a question on paired student t-test. No student was able to tell me what exactly was due to. Dr. Nandu, I'll come to that question. That was a separate question of MMR. Paired student t-test, there was a question. Okay, growth failure was a pediatric question. Then I'll skip it. I'll skip it. Paired student t-test, what was the question, friends? Anyone can write just in few sentences or one sentence only. Okay, students are saying this was a question of pediatrics related to growth rate. Okay, So Dr. Anand will cover that. Paired student t-test. Okay, before and after was mentioned. If it was a parametric data, normally distributed data, then it has to be paired student t-test. If it was a non-parametric qualitative data we have discussed, percentage, proportion, fraction is given, then it has to be sign test, right? Okay, mean comparison before and after. So that makes it easy. Mean before versus after. Now there is no doubt in the question. Students have confirmed it is going to be paired student t-test. Lipid profile mean. Okay. So we were asked about lipid profile or lipid some parameter value before and after. Wonderful. So 80 people before and after, pre and post, this has to be paired student t-test. Okay, I think this is a pharmacology question. Falciparum vivax mixed infection. So covered by Dr. Govindrai Garg sir. I'll move forward. Okay. There was a question, 22 weeks period of gestation lady, sexually assaulted. She needs MTP. What will you do? So friends, we have already discussed up to 20 weeks. This is low risk. 20 to 24-week high risk. And what is covered in high risk are actually the women who are of special category, belonging to special category, or who are vulnerable. Now, what are these special categories? Special categories actually include rape, that is sexual assault, incest, minors, disabilities. Right? So it is permitted till 24 weeks period of gestation. We have to remember and mark the answer accordingly. Beyond 24 weeks, medical board only in cases of substantial fetal anomalies we have discussed. Right? Okay, paired t-test was in first. Thank you so much. Okay. Even if it is minor, even if it is incest, still it falls in the special vulnerable category, high risk 20 to 24. 20 to 24. Okay. Yes, it is allowed. Termination is allowed to be done for up to 24 weeks, right? This was a question from PC PNDT Act. This was a separate question. Some mentioned that they also had mentioned Beti Bachao, Beti Padhao, Beti Bachao Andolan also in the question. PC PNDT Act, what did you mark? They gave a situation where a woman reports to you with USG scan. She's already having 4 children. What will you do? Will you do a USG scan? If you do, will you look at the fetus gender and you will not tell the woman? Or you will also not see the fetus gender and will not tell the woman? Or you will not do the scan at all? Scan at all. So what did you mark, friends? Quickly write in the chat box. Please remember in this, you will have to do USG. The act does not permit to see the fetus gender until and unless it is warranted by some legal indication. And of course, we will not tell the woman. We will not tell the woman, right? Okay. We are not allowed to see the sex until unless there is a requirement. You can only check for genetic anomalies, chromosomal, metabolic anomalies. Please remember. Yes, even if she is having 1, 2, 4, 0, 10 girl children, it will not make a difference. It will not make a difference. Right? Okay. Photograph was of PCPNDT Act. We are saying. Okay. Okay, this is the same question by mistake. Was there any question on steps of case control study asked in the paper? I think it may be there if it was there in 2. In paper 2, if it was there, then these are the correct steps because students were not able to construct the choices properly. Logically, you will first have 2 groups, cases, controls. Then you will do matching so that we can eliminate all sorts of confounding. Then you measure the exposure through asking history. And then you do analysis and interpretation where odds ratio is calculated. Odds ratio is calculated, right? Okay. But USG scan, any problem, Dr. Atul sir will be coming in a subsequent session. Please discuss with him that part also. So case control study, right? Okay, steps of disaster cycle was asked in a sequence. I believe choices were similar to this. So first of all, disaster has to strike. So impact should be there. After impact, you will respond. Response will include your medical treatment, first aid, triage, everything. Then you go for rehabilitation. And in the end comes mitigation. In case they give a fifth step also, then last step is preparedness for the next disaster to strike. Right? So please remember, depending on this, actually there are 5 steps: impact, response, rehabilitate, mitigate, prepare. Right? Okay. In case it is there. So this is the correct sequence depending on the choices. Yes, sampling question also I'll ask from you, Dr. Khan. I'll come to that. There was a question on MMR calculation. I'll come to that because students are not able to tell me beyond this. There was a question on early neonatal mortality rate calculation. Students say they were not able to tell me the values. Early neonatal is 0 to 7 days. Late neonatal is 8 to 28 days. So we know all mortalities. Early neonatal mortality rate will include early neonatal deaths upon live births in 2000. I will get all the questions completed by tomorrow and I'll release the video also, right? So this must be in session 2. Most of the incomplete questions because logically session 2 was there, right? Okay, stillbirths were also given. So if stillbirths were given, as we discussed in our revision sessions also, denominator will include total births minus stillbirths. So live birth will be total births minus stillbirths, right? Okay. This is neonatal mortality rate. Similarly, MMR calculation also. Denominator is live birth, which is total birth minus stillbirth. This is the rule in all the MCH indicators. All the MCH indicators. Yes, deaths you must have been able to calculate correctly. There was one question which will come. Okay, there were 6 deaths in maternal. So you can calculate depending on the total births and stillbirths given, right? MMR formula we have already discussed. Okay, this was some sort of question I heard that there were 4,000 live births, 6 women died, but students were saying there were questions on mentioned about obstructed labor, shock, PPH, snake bite. So I can tell you, depending on the numbers given, snake bite will not be included. Why so, friends? Because maternal death has to be related to maternity or its complication. Maternity or its complications. Yes, Carter thermometer we have discussed, Dr. Sandeep. There was a question on cholera vaccine. Again, students were not clear very much. So I have telling you both the vaccines which are available. We have Dukoral and Sancol depending on the vaccine asked. Please remember, Dukoral is monovalent, Sancol is bivalent. Both are given 2 doses, but in Dukoral, if child is below 5 years, then we give 3 doses. Below 2 years, it's not given. So below 2 years, it is not given. One booster dose is recommended in both. Okay. In MMR question, if sepsis was there, it will be included in numerator. If accident was there, accident will not be included. Death has to be only related to maternity or its complications. Road traffic accident will not be included, friends. I'm checking your comments in the chat box, right? Okay, let's move further. Okay, PQLI, this question we have discussed. So one set in the morning had HDI, set 2 in the evening had PQLI. So we know all the. Okay, Sencol was asked. So one student has confirmed. Thank you, dear. Sencol, you have to know these things, right? Even if they ask you CVD 103 HGR, that is now completely phased out. That live attenuated 1 dose vaccine for cholera is not used, right? Okay. Road traffic accident, ignore in MMR. PQLI indicators we have discussed. Okay, this was what students exactly told me. This was the image, right? Kata thermometer used for low air velocity, Dr. Ashish. Lower velocity not in the choice. Older answer, cooling power of air. Yes, that also I'll come to that, Dr. Bhumika. So this was Sapna leprosy, right? Okay. Question on sanguinary toxicity. Drug inspector will do which test? So friends, you tell me which test should be done, which test should be done in sanguinary. Sanguinary means which disease are we talking of, friends? Sanguinary means which disease we are talking of? Yes, we are talking of epidemic dropsy. Argemone mexicana oil. We have got two tests. Paper chromatography test is most sensitive. If you want, you can do a nitric acid test also. Right? So this was also a repeat question. Let us move. Okay, one choice was methylene blue reduction test. Thank you, Dr. John Vinay. Methylene blue reduction test, which is actually used for pasteurization of milk. Which milk should be accepted for pasteurization? Most sensitive. Paper chromatography test. There is no doubt in that. Paper chromatography is considered most sensitive. Okay, there was a question. People cannot understand your few words. If they cannot understand your few words during a health education session, then this is a cultural barrier. See, physiological barrier is when there is too much of noise. Suppose a big plane is nearby, some sound is coming, some music is going on. That is physiological. But cultural is they cannot understand your words at all. And students categorically mentioned, this was mentioned in the question that they cannot understand your words, right? Okay, let's move further. Okay, this was a pharma question, short regimen of beta-quilline. I'll discuss with Dr. Govind Rai Garg sir if he has not discussed. Logo of leprosy program was asked, right? There are 10 to 11 programs also only we have discussed their logos which are asked in the paper, right? Okay. Okay, argemone oil adulteration in mustard oil is same as epidemic dropsy, Dr. Talk, right? Okay, even it's not semantic, it is cultural, right? Okay, linguistic, no, it's not linguistic. Okay, there was a question on health education model. Multiple models are there, out of which motivation model is mostly used. See what they mentioned in the question. First step is awareness, friends. Look at this. Second step is motivation. You tell me what should be the logical answer. Should it be contemplation? Should it be dedication? Should it be action or reflection? Awareness, motivation. I am educating you, let us say, about use of N95 mask. I make you aware how it is useful for prevention of COVID-19. You get motivated. Logically, the third step has to be action, right? So there are three steps. Number one, awareness. Number two, motivation. But why we are giving health education to public? Ultimately, we want to change their behavior. Action is the final step. Action is the final step. So many students found this question very logical and easy. Okay, students told me the test was asked, statistical test to compare association of veg and non-veg consumption of food with a particular disease. If you were given a question with this language, paper 2, then it has to be chi-square test. Because you will be comparing proportion of vegetarians developing the disease, proportion of non-vegetarians developing that disease, and when you compare proportions in two or more groups, it is chi-square test which should be used. If this was the language of the question. Previous paper one, there was a question on paired student t-test where we were comparing mean lipid value before and after an intervention, right? Okay. Paper two. Okay, wonderful. Everyone has marked this correct. Okay, this question you need to tell me choices because no one was able to tell me choices. Ayushman Bharat not included in school care. What were the choices, friends? Okay, wonderful. Dr. Naman, Dr. Zeus, everyone is right. Dr. Zeus, you are right. Ayushman Bharat not included in school health care. if they ask you broadly, what I did, I have included all components here. Health promotion, health screening, iron folic acid, albendazole, sanitary napkin distribution to adolescent girls, vaccines, EHR is electronic health records, and first aid. This first aid training is given to teachers. Please remember, first aid training is given to teachers. Iron tablet is given. Ayushman Bharat program, IFA, albendazole through Anemia Mukt Bharat is a part of this particular program. Deworming is also done through albendazole. Okay, deworming albendazole was one choice. So they are definitely part. Sanitary napkin is also a part. So if there are four choices, then beside these three, whatever the fourth choice, that could be the answer, right? Okay, so leave this portion. There was a question on stratified random sampling, but this is the maximum students have been able to tell me. I'll tell you what is stratified random sampling as we discussed in our main videos and mission videos and marathon session also. You divide heterogeneous population into homogeneous groups or strata. Boys, girls sitting together. Remember the example I discussed? We first make them sit separately. So straight or layers are created, boys on one side, girls on one side. And then from boys on girls, we select, yes, randomly the probability proportionate to size. Yes, if in this question, iron folic acid was mentioned as monthly, then that will become the answer because it is not given on a monthly basis. All of us have seen the iron folic acid supplementation, right? Okay. Yes, molar pregnancy will be included in definitely MMR. Now, stratified random sampling, I've told you depending on the question how they did. Okay, three groups were there. Dr. Shubham Goyal has helped us. Plants, animals, humans. So you have already done the stratification. So among the total population, you have divided into plants, animal, humans, and from them, each you are selecting units of your sample by random sampling. So this is, yeah, definitely stratified random sampling, right? Okay, there was a question on quarantine. They said a disease was mentioned where incubation period was 5 to 14 days and median incubation period was 10 days. As we have discussed categorically in all our sessions, quarantine is always done for longest incubation period of the disease. Like if you remember, we must have discussed yellow fever. 2 to 6 days is the incubation period, friends. So what is the quarantine period is maximum incubation period. So in case 5 to 14 was given as the incubation period range, then your answer will become 14 days as the maximum incubation period of quarantine. Okay, there was a question. Will go in physiology, medicine, PSM, many subjects. A scurvy look like X-ray. Students mentioned there was Frankel's line, Wimberger's. Remember, I told you that X-rays of scurvy rickets you have to see in radiology with Dr. Zainab and other subjects also. And they asked patient had anemia, neutropenia, skin pigmentation. So friends, it has to be copper. Copper produces features of pseudoscurvy that is known as pseudoscurvy, right? In case that question was there, right? Okay. Then there was a question on, I think, set 2, today's evening paper, arrange events of demographic cycle. So high stationary, early expanding, late expanding, low stationary, declining. Right? We have discussed in detail. In paper 1, they asked about the diagram. What is the blue line death rate? In paper 2, they asked the same 5 stages to be arranged in a correct chronological sequence. correct chronological sequence. Even if it was given Dr. Hardy 3 to 14, 14 will become the correct answer, right? Okay. Then there was a question on trachoma image will go in ophtha. In case Herbert Pitts was there, I told you at PHC level, we diagnosed by one of the four features is limbal follicles. So in case they showed you limbal follicles, which has a high chance of being shown in the paper, right? Okay. This was a question we'll go with medicine. Diagram was this, I can tell you. This is seen in chronic hepatitis B and resolved hepatitis B both. Depending on the diagram, you can see anti-HB he has appeared. So in case it is chronic hepatitis B picture, then it will be definitely with no longer infectivity because now person will start improving. Okay, please help me complete this question. I'm moving faster because the teachers are waiting. There is a question on diphtheria prophylaxis antitoxin. Please write in the chat box. I'll complete this question, or you can WhatsApp as students have been doing. I'll come with a detailed answer, right? Okay, Herbert Pitts was there. Then you must have been able to identify. I showed you the same image which was released by the trachoma control program, right? Okay. Enteric fever. Basu, I was told that 4 days of symptoms. So classical question since years. Blood culture, first week onwards. Antibodies, that is Vidal, third week, fourth week. In fact, they say 1 week onward, 2 week onward, 3/4. Overall, if they ask, even then, blood culture is overall the smartest or the best test to diagnose enteric fever. So friends, Sapna leprosy was a slightly different question, slightly different in the sense it was asked for the first time, right? Okay, question was related to booster dose of diphtheria. Okay, so friends, I'll complete the questions and I'll try to release all answers by tomorrow. I'm presuming that majority of questions, 20 questions in each set, 17 to 18, every student should have attempted correctly. These were the questions, right? Okay.